KLIF News and Information time is now 7:11. New study shows mistakes happen all the time during surgery. In fact, half the time it comes to the drugs.
You don't want to hear that.
Given before and after surgery. You have to keep one eye open almost when you're in the hospital.
We will talk with a physician.
We're doing that right now, actually. Dr.
That's
Russell
right.
Skinner joins us now live. Good morning, doctor. What kind of mistakes? What kind of mistakes are happening?
The study showed that nearly half of surgeries have some sort of medication error, although it's not quite as bad as it sounds. Some of the errors were simply protocol errors. For instance, if a medication were drawn up in a syringe and that syringe weren't properly labeled, it was counted as an error. Now, part of the reason they did that is that without that syringe being labeled, there's a potential for an error to be made somewhere down the line. So there were some of the things that did not actually cause harm to the patient, but nonetheless were considered an error and were potentials for harm.
Also read something about, you can clarify this because I really didn't understand it, but there was one explanation was that, look, when things are going on in surgery, sometimes you have to make split-second decisions and you don't maybe have all the information you need about a patient's history to plug them into a particular drug or something along those lines. Is that right?
Exactly. And, today with electronic health records and so forth, we use electronic records at my office, for instance, and when I go to write a electronic prescription that's going to go directly to the pharmacy, I get an instant feedback of drug-to-drug interactions with other medicines they're taking, whether or not that conflicts with something that's on their allergy list, and so on. We have to kind of go through that process of weeding through those side effects, seeing if it's something that's going to prompt us to change medications or if it's a minor side effect that we can live with for a short period of time and so on. But you're right, in the throes of a surgical procedure, particularly if something becomes emergent, there's not that step, there's not that review. Most hospitals, even if you order a medication on the floor, for instance, patient's in the hospital overnight and doctor orders a medication, it gets reviewed at the pharmacy level, it gets reviewed again at the nursing level before it's administered, and then that medication gets given. In the operating room, if something's happening very quickly, it may be give them X, and it needs to happen right now, and so it's simply just drawn up and given. And if it conflicts with something on the chart, there may not be time for all of those checks and balances to happen. There are definitely some things I think that could be put into place to help minimize that, but there's a certain amount of that is just kind of the fog of surgery, so to speak.
We're talking to Dr. Russell Skinner, a physician at the Family Health and Wellness Center in Plano, about a new study showing drug mistakes happen in half of all surgeries. Is there anything that a patient can do before they go into surgery to make sure that these mistakes don't happen?
Probably the best thing they can do is to be completely forthcoming on their history. I have patients that will come in. We take a history, allergies, previous medications, and so on. And sometimes they're either hesitant to say something they forget, which is just an honest mistake. I forgot that, my mom told me that I had a reaction to that medication when I was a kid, and they forget. Or they believe that, well, it wasn't serious, so I don't need to say anything about it. But everything having to do with medications is important to disclose to your doctor, disclose to your anesthesiologist, in this case, as part of a pre-op evaluation. But it's really important those patients tell us, I didn't do well with this medication. I've had a reaction to this one. I don't know if this is allergic or not, but when I had this happened. All of that information can get at least into the chart and into the record and be reviewed prior to surgery. That's the best that a patient can do. It's still up to the clinical staff then to review that information and have it at hand so when medication is ordered, they're able to cross-check.
All right, Dr. Skinner, thank you very much for your time. We appreciate the information, and I think you put our minds at rest a little bit. Appreciate that, too.
Yes, thank you very much. Thanks for having me on.
Dr. Russell Skinner at the Family Health and Wellness Center in Plano.